Welcome back to the program. If you're just joining us, this is your favorite Pan-African show, Bottomline Africa, right here on KTN News. And tonight we're not going to discuss politics, although we have a politician in studio. We're going to discuss about one of the major killer diseases in the continent, and that is malaria. This comes hot on the heels after 26 deaths were reported in North Horn constituency in Marsabit County. And let me just tease our guest quickly. We have Dr. Wako Ejersa, who is the head of Malaria Control Unit from the Ministry of Health. We also have Honorable Chachu Genya, who is a member of Parliament from North Horn constituency. We also have Dr. Robert Bet, who is the Public Health Manager from the Kenyan Red Cross Society. I'm going to discuss with them shortly about this disease, but for now, just allow me to cross over to Kampala, Uganda, very briefly, where my colleague Solomon Serawanja got an exclusive interview, a one-on-one interview with Uganda's main opposition leader, Kizza Besigye, Dr. Kizza Besigye, and he had something to talk about the current political situation in Kenya. Let's listen in.
We're following the developments in Kenya of Raila Odinga abandoning the electoral process. NASA will not participate in the fresh elections, so to speak, organized by the IEBC. And now we want to pick some thoughts from key opposition leader here in Uganda, Dr. Kizza Besigye, about what he thinks on NASA's decision to get out of the race. All right, thanks so much for joining us, Dr. Kizza Besigye. Let's start with your general thought on NASA's decision. What do you make of it?
Well, frankly, when I first heard it, I was confused as to what they were trying to achieve. But having read their statement, I think their intention is clear. It's a tactical maneuver on their part to have more time ahead of the next election following the annulment, because the Constitution, I think, imposes a period of 60 days within which another election should be organized. And they have been complaining that the grievances they took to court that led to the annulment won't be rectified ahead of the next election. And I think the main grievances they have been talking about is the Electoral Commission itself, reforming the Electoral Commission, which was found wanting by the Supreme Court, and also reforming the processes of organizing the election, the procurement processes for the ICT, for the electoral materials, and so on and so forth. I think the main challenge to reforming those things, it was said, was time, that within the 60 days it would not be possible. I think it is important that ahead of any election, there is maximum consensus by parties to the election, or people who are taking part in an election. There should be an effort to have maximum consensus on the process. And secondly, there should be maximum transparency in how the process is conducted till the end. If those things are not there, then they cause trouble that starts to brew in these countries. And the instability we have had in Africa, frankly, is traceable to how political processes have been managed, whether they have been managed fairly and transparently.
Well, you rise on the same grounds in the several elections. You don't trust, you used not to trust, I don't know if you do now, the Electoral Commission and electoral processes in Uganda, and perhaps that's the same issue that Raila Odinga is premising his withdrawal from the elections.
Well, first of all, I must make a caveat when commenting on Kenyan issues. I have had challenges by Kenyans saying, you know, how do you start interfering with our own processes? I would like to make it very clear that I am not fully seized of all the nitty-gritties of their political system. So my comments are comments really on the broader issues of principle. Secondly, I have no preferences in terms of which party in Kenya governs Kenya, really. I think my interest would be best served if the party that the people of Kenya support most takes leadership. So my only interest is how to establish which party is supported most. That there must be fairness, there must be justice, that there must be transparency in the process. And if you go by what the Supreme Court said, the Supreme Court certainly had issues with how IBEC had conducted the election. And therefore, zooming into IBEC to see whether it's in a form that will act differently, I think is fair enough. Now, the tactical maneuver they have taken, that NASA has taken, and how it will play out, really, I don't know. But I think the best thing, as far as I'm concerned, would be for all parties to step back and have a dialogue so that there is maximum consensus on how they go forward. Once they are agreed on how they manage the process, eventually the party that has the greatest support will provide leadership to Kenya. If the greatest support is with the Jubilee, as had been declared, it will still come out as the winner of the election. So I think Kenyans, as all of us, indeed East Africans, and we have a legitimate interest in what happens in Kenya, because what happens in Kenya affects us. I think the overwhelming focus must be on the fairness. Let's have dialogue. I think there is need to have dialogue, to have consensus on the process, rather than having confrontation that cannot lead to resolution of the process.
If you had an opportunity to speak to Raila Odinga, I mean, you're synonymous with defiance. You know, you've on several occasions called for demonstrations from Ugandans who don't believe in the way the NRM regime is operating Uganda. Similar to Kenya, Raila Odinga has called for massive protests. We've seen different protests in different parts of the country. What would you tell him, especially at such a time?
Well, again, frankly, I don't think I'm the best placed person to advise Kenyans, whether it's Raila, whether it's the leaders of Jubilee, on how to project their interests best. As I have said, I'm not seized with all the nitty-gritties of what goes on in the Kenyan polity, and so I think it would be imprudent to start prescribing what needs to be done. Having said that, what I know as of general principle is that if someone feels aggrieved and their grievances are not being attended to in a manner that they feel is reasonable, I think they are well justified to struggle to be heard in these political processes. Because, again, what eventually establishes a democratic dispensation, what establishes a democratic culture, is having respect for all political views, even minorities, especially on important fundamental questions like elections. There is need to have maximum consensus, and therefore you will not be heard unless you assert your will to be heard. If you are meek and you say, what can I do? Nobody will hear what you are saying. So that is the way I look at things.
All right, Doctor, of course, we know that the international community is keeping an eye on Kenya right now and the developments there. The EU has made a statement. The American ambassador there also yesterday called for stability in Kenya. And yet, a lot of different people, for example, from NASA, challenging the reactions from the international community. What are your thoughts on the way the international community is conducting itself on the developments in Kenya?
Well, I once again would not like to be judgmental in what is influencing them to do or say what they are saying. Coming from a remote position that I am doing. But I have my own experience here with the international community and how they interface with the political processes. And I think here they have been making very serious mistakes in taking matters of what they call stability as the most critical in the political processes. And stability, they tend to translate it to mean maintaining the status quo. And so they tend to think that if they rally behind the powerful, there will be stability. And I think that's a grave error. It has caused us a lot of problems here. In fact, when Mr. Museveni went to the bush in 1980, there was a big Commonwealth election observer team that was here in Uganda and that said that the election had been free and fair.
That was my colleague Solomon Serawanja having a one-on-one interview with Uganda's opposition leader, Dr. Kizza Besigye, who clearly indicated that what happens in Kenya also affects the region and the continent as well. Of course, Africa is watching. The East African region is watching, even as Kenya tries to come out of the current political crisis. This after NASA leader Raila Odinga withdrew his candidature from the October 26th presidential rerun. And as earlier I've promised you, tonight we're not having a political discussion, we're having something to do with the biggest killer disease in the continent, which is malaria. And tonight, let me reintroduce our guest once again. We have Dr. Wako Ejersa, who is the head of Malaria Control Unit from the Ministry of Health. We also have Honorable Chachu Genya, who is the North Horn Member of Parliament. We also have Dr. Robert Bett, who is the Public Health Manager, Kenya Red Cross. Good evening, gentlemen. Welcome to the show, and thanks for braving what has been a rainy day in Nairobi.
Thank you.
Thank you, Yusuf. Thank you.
Thank you, Yusuf.
You're most welcome. So, Honorable Chachu, let me begin with you. And reports from the ground indicate that the outbreak in Marsabit County, to be specific, in North Horn constituency, has claimed a total of 26 lives in just 2 weeks. The county health workers and NGOs are on high alert following the epidemic. All the deaths were reported in North Horn constituency, and medical tests on Wednesday showed that at least 70% of the residents in Dukana have malaria. What is being done to make sure that there is no further loss of lives, and what is the current situation on the ground?
Yusuf, thank you so much for having us. It's true we have had a serious malaria crisis in Northern constituency.
Yes.
As you said, 26 people have died, mostly from Dukana area, but we also do have some lives which were lost in Ilret and some parts of North Horn Ward as well. As of now, the situation is largely under control, thanks to the county government of Marsabit, Kenya Red Cross, FHI, UNICEF, Doctors of the World, MSF Belgium, and many other actors who came on board to support the problem that was there. As of now, we do have drugs. Kenya Red Cross did airlift drugs and medical personnel to Dukana and other parts of North Horn. There is a mobile outreach right now, whereby people are using four-wheel vehicles, ambulances, to reach out to the nomadic communities in the most part of Northern constituency. And since the interventions of that has been done by Red Cross and the county government and national government as well,
yes,
we have not had any deaths as of now.
Yeah, but Honorable Chachu, I'm sure you'll agree with me that 26 is a very big number. What contributed to that? Because we're getting reports from the ground that one of the reasons is because of lack of access to healthcare. Is that the case?
That is true. Of course, Northern being a low malaria endemic area, we were ill prepared for this. As a result, when this problem occurred, we didn't have enough drugs in the hospitals. We didn't have enough medical personnel on the ground. We didn't have the drugs which are actually free in this country in our hospitals. And so it took quite a few days or sometimes before any interventions were done. And that's actually why we lost almost, I think, about 6 lives. It's only after that that the medical personnel came on the ground, and after tests were done, then it was discovered that it was actually malaria which is actually taking our people's lives away. As a result, interventions were done by the county government and Kenya Red Cross and others, and that's how we are able to arrest the situation.
Allow me to bring Dr. Wako into this conversation. Now, Daktari, what is the ministry doing on the ground at this moment to make sure that the situation is brought under control?
Thank you, Yusuf. Maybe I would want to really explain this phenomenon that we are seeing. I may start by saying that we have zoned this country into about 5 epidemiological blocks. We have the lake endemic region, you know, the former Nyanza province, and the coast endemic. These areas are endemic in that transmission occurs throughout the year. Then we have the low-risk areas of Nairobi and the Central Province. Then Western Highland, the Kisses and parts of Central Rift. And then now this area that we are in, we call it seasonal transmission belt, that goes all the way from East Pokot in Baringo to West Pokot to Rukana, Samburu, Marsabit, Isiolo, the whole of Northeastern, and it includes also Tana River. Now, what are the characteristics of this seasonal belt, the epidemiological block? One of the things is that it has very low prevalence under normal circumstances, and that's why we call it a seasonal transmission belt. So the season means that malaria is seen following some rainfall. So what happened in this situation is that this is an area that is not used to malaria, otherwise less than 1% in the normal setting. Now they received some more than usual rainfall around July, August. So that created a very good environment for mosquito breeding after the rains, together with the high temperatures. So we got a lot of mosquitoes to transmit the parasite.
So that contributed to the outbreak, according to a view there?
Yes, a very heavy contributor is the rain and the pool of water that accumulated after the rains. So mosquito population grew very fast. Then this was now coupled with the nurses' strike.
Yes. Actually, we are going to talk about the nurses' strike shortly. Let's talk about, access to health. This is a human rights issue, and at this moment, we're being told that, the numbers there, that 26 is a very big number. It has largely been caused by the fact that people don't get access to health. So what is the government doing to make sure that they get some sort of a long-term solution to this?
Well, I think the main culprit here, it's the nurses' strike. I must say that all those facilities are manned by nurses.
Yes.
All those rural facilities. And when they down their tools and go to the bigger cities, our communities are just left like that, without any attendant.
Yes.
And usually the nurse is the one who will order for the commodities, for the antimalarials, will treat the few patients. But now the absence of the nurse means a lot, really, that there is nobody to treat the patients, and the parasitemia keeps on increasing within the community, and the mosquitoes I talked about. So a very ripe environment. Now, what can we do? Is really a serious dialogue has to happen in this country between the county governments, the union, the national government mechanisms, not just Ministry of Health, the Salaries and Remuneration Commission, the Council of Governors, the Ministry of Health, of course. We really need to put our heads together, and a strong voice has to come so that normalcy in the health sector can come back.
Of course, we do hope to get a light at the end of the tunnel. Now, Dr. Bet, according to Honorable Chacho, Red Cross there did a commendable job in Marsabit. Can you give us a rough picture of how the current situation is? I'm sure you have officials there on the ground. Has, this outbreak been totally put under control?
Yusuf, as you, Honorable Church was put it out, is that we were on ground for responding to the drought situation that has been impacting the northern districts and mostly the arid, semi-arid lands in this country for the past few months. So we had a team in Dukana and some parts of Marsabit. So when we received information that we had this outbreak situation in Marsabit, we just reassigned the staff to go to attend to the situation. And we beefed up the surge capacity team that was there and repositioned the supplies that we had in our warehouses and the ones that we had in the region. We have 2 branches in Marsabit County. One is in Moyale and the other is in Marsabit Town. So we had a few mosquito nets in Moyale branch, which was then sent to Dukana through to supporting the county government and the national government initiatives to bring this outbreak under control. So far, I'll say we are on the right path towards containing the situation. We had also sent a few, let's say about 2,000 doses of antimalarials, but this was on the initial phase, and just as we are waiting for the supplies from the other parts of the country through the national government channels to get to the ground to respond to this situation adequately. As Dr. Wako has put it, the nurses, our healthcare system works on a pull system where the nurses order for drugs from the supply stores from the county or from the national government, and then it gets to the ground. So the health sector had been facing crisis. There were limited drugs on the ground, but we came in and sent the doses of drugs down there and the mosquito nets to support the response. But the national government and the county government have launched a comprehensive response, and we are going to see a good trend going down. However,
exactly. We're all waiting to see how they're going to operate on the ground there. Now, Honorable Chacho, we all understand that health is now a devolved function, is under the county government. And once again, the reason as to why the huge number of deaths were reported, 26 in particular, is because these people cannot access, these health facilities. Do you think more needs to be done by the county government?
Yes, for sure, Yusuf. Actually, I agree with Dr. Wako to a degree because it's not just the nurses' strike which actually really caused this problem not to really be arrested.
Yes.
It's more than that because we actually don't have health facilities, and where we don't have personnel in those health facilities. In Dukana, where this problem actually happened, we only had one clinical officer. He went on study leave. When this problem actually started in Dukana, there wasn't actually any medical personnel per se really to assist those patients. They had to send 2 clinical officers from Marsabit to Dukana, and that's actually how they were able to find out that actually this problem is caused by malaria. So even where we have facilities, and for sure, yes, through the county government, some dispensaries have been built in the last 4 or 5 years. But even where we have these facilities, there are no nurses or clinical officers. So a lot has to be done. It's more than just lack of drug or lack of facilities.
Yes.
So even where we have facilities, we don't have those personnel.
Yes, let me cross over to Dr. Wako now. I understand this is not just a Marsabit problem or a Kenyan problem, but it's also a problem that is facing the continent. I understand that there's no one-size-fits-all solution to wipe malaria out, but research indicates that the most effective way to deal with malaria is prevention, which is use of mosquito nets and insecticides. But research indicates that the worry is that these mosquitoes have built resistance to certain chemicals. Is that the case?
Yes. The resistance is of 2 types. As you said, the mainstay of prevention is the long-lasting insecticidal nets. They have chemicals that are mainly pyrethroids, and then the indoor residual spraying chemicals that we use, the primifos methyl at the moment. We have seen some resistance to pyrethroids that were used for IRS. That's how we changed to the actelic, or what we call primifos methyl. So there is documented resistance to the chemicals that are used especially for indoor residual spraying. Fortunately, in Africa, what we don't have is the resistance to the medicines that are used for the parasite. We are very fortunate in that. So the artemisinin combination therapies that we use as first-line and second-line treatment, and even for severe malaria, there's no documented resistance by the parasite. But the mosquito is very mischievous. It keeps, resisting the chemicals that we use.
Now, according to the 2014 World Malaria Report, Dr. the number of infections across Africa decreased by 26% from 173 million, that is in the year 2000, to 128 million in 2013. It seems the cases is decreasing in the continent. But why are we seeing some sort of a resurgence in Kenya? Case in point, what happened in Marsabit, or is it just an isolated case?
Well, thank you, Yusuf. I think, in a nutshell, we are seeing very much serious improvements in malaria. For example, in the lake endemic region, which is the main focus of the malaria program because of the high prevalence, between 2010 and 2015, the prevalence reduced from 38% to 27%. And as an average for the country, during the same period, 2010 to 2015, the prevalence reduced from 11 to 8%. So there is a downward trend in terms of the prevalence, but this particular upside that's happening in the seasonal belt is an isolated phenomenon that we could explain because of a combination of issues. One of the very important issues is what we talked about, the nurses' strike. No one is there to man any infection. Malaria, one of the key preventive strategies is actually treatment. Effective treatment within 24 hours is a good prevention strategy because you are reducing the parasitemia within the population. Now, if all the facilities are closed, and then people walk around with parasitemia, then there is some rain out there with a very huge number of mosquitoes. What do you expect? There's a lot of transmission that will go on, and that these people have very low immunity to malaria because the experience with malaria is very low. This phenomenon cannot be observed, for example, in the coast region because it's already endemic with malaria, and the lake endemic region. You cannot observe this kind of outbreak situation. But if malaria is introduced in a situation where people are very low immunity, you will see dramatic effects, like so many people becoming sick at the same time, going to anemia, and unfortunately some go ahead to die.
Well explained, Dr. Dr. Bet, I understand that NASA strike has now entered its 129 days. I stand to be corrected. So has that affected your operation on the ground?
Definitely, Yusuf, the NASA strike is posing challenges on our response in most parts of the country. As I said, we are not only in Marsabit, we are also in Baringo, Turkana, Wajir, and all that on the northern frontier districts. And of course, if you have to refer a patient from one point of the county to a more comprehensive facility, you will not be able to, get certain services in those facilities because they are close, and it's a challenge for most people in these counties, which rely mostly on public health facilities.
And Dr. Bet, how is the coordination like on the ground between maybe the county government, the national government, as well as other interested parties like the Red Cross?
So we work very closely with the county government and the national government for responses that we are attending to. We do not work in a vacuum, and we have the mandate to work as an auxiliary body to government, providing support on a humanitarian need basis and to alleviate human suffering wherever it is and to avert deaths. Malaria affects the young children and the pregnant mothers worse than others, and this is something of concern to all parties. And, we come together, we sit at the table and, come up with strategies of, containing the situation. Like when the county government and the national government approached us to support them in deploying teams to these areas to contain the situation. We airlifted a team and some supplies to these regions to support basically the response there. But in the end, we cannot attend to the entire situation. There's need, as Dr. Wako has put it out there, that there is a need for a consensus building and introspection, auditing our healthcare system, where we are and where we need to go, seeing what is working, what is not working, and trying to plug it so that we can be able to improve the lives of our people wherever they are.
Exactly.
So,
Dr. Bet,
yeah.
thank you for that. I think that will serve as a final comment. Now, Honorable Chacho, as you make your final comment, there are those who are saying that you are also a member of parliament. The NASA strike largely contributed to the death there in Marsabit, and it seems the MPs are very much interested in changing the election laws. When do we expect these issues to do with NASA's to be actually raised in parliament?
Yusuf, as you know, health is a largely devolved function, and this largely lies with the Council of Governors. But as national leaders, we surely look for the necessary enabling policy that will enable them to negotiate in a way that will be in the best interest of all the stakeholders. I want to just mention that as we deal with this issue of malaria, particularly in vast constituencies like Northor, where the societies are largely nomadic or mobile communities, I think having some very innovative mobile outreach programs whereby we're able to target these nomadic households and families where they are through mobile outreach, mobile medical outreach, would be the best way to go, than rather just putting facilities which these people are not able to access due to the vastness of the area, the distance involved, and the fact that most of these health facilities are not even accessible to them. So I think going forward, I think, and to even avert this kind of crisis in the future, I think we should put more focus on innovative mobile outreach services for these nomadic communities like the Gabra community of Northor.
Well said. Dr. Wako, your final comment before we wrap up?
Yeah, thank you very much. I think my final comment would be, one is to commend the nurses union officials that actually innovatively in Marsabit County decided to agree to respond to such outbreaks, and I urge other branches around the seasonal belt areas, in case there is any upsurge, that they respect the union waiver that was given. Maybe I'll urge all those counties that I've mentioned that lie in the seasonal belt to do what we call pre-positioning of commodities, that they get enough stocks of commodities from our KEMSA, the Kenya Medical Supplies Agency. I want to assure Kenyans that we have no shortage of the antimalarials and even the rapid diagnostic test kits. So please do order these commodities and position them. Do not wait for outbreak to really collect the commodities. And I want to thank everyone who was involved in this mega response. It was a very quick response and really worked so quickly. The Ministry of Health gave a lot of medicines, over 200,000 doses of ACTs and over 250,000 nets to cover the populations of Turkana, Baringo, and Marsabit, the Northor sub-county, and of course Red Cross and other agencies that really came in very handy.
Yes, well said. That is Dr. Wako Jessos, the head of Malaria Control Unit from the Ministry of Health. We also had Honorable Chacho Genya, who is the Member of Parliament from Northern constituency, as well as Dr. Robert Bet, Public Health Manager from the Kenya Red Cross. Thank you very much, gentlemen, and thank you for coming to the show. Now, before we end the show, let's cross over to our images of the day, which comes from Rabat, that is in Morocco. And in a country where nearly half of people with mental disabilities are unemployed, one restaurant in the Moroccan capital is part of a pilot project tackling the problem. When a customer enters the Hadaf restaurant in the capital's business district, nothing indicates that many of the staff are disabled in any way. The experiment was launched by a local association created by parents to shake up prejudices and serve as a springboard for young people with mental disabilities. Take a look at some of their sumptuous delights there, as you can see on the screen. Well, before our bottom line editorial tonight, let's take a look at our proverb of the day. Clearly, I did see that coming, and I'll blame that on our producer, Faith, who is in the gallery right now. Anyway, finally, here is the bottom line tonight. Tonight, about 20,000 children under the age of 5 will die of diseases that could easily have been treated or prevented. This tragedy is repeated every day around the world, especially in sub-Saharan Africa. Malaria, for example, kills about 400,000 people every year on the African continent alone, as many governments fail to tackle the disease. Now, the right to the highest attainable standard of health requires a set of social criteria that is conducive to the health of all people, including the availability of health services, safe working conditions, adequate housing, and nutritious foods. Now, vulnerable and marginalized groups in societies are often less likely to enjoy their right to health. 3 of the world's most fatal communicable diseases, malaria, HIV, AIDS, and tuberculosis, disproportionately affect the world's poorest population, placing a tremendous burden on the economies of developing countries. Now, clearly, the daily death toll can be prevented and in our lifetime, but it won't happen overnight or without real commitment and focus. We must not allow a situation where people die because of preventable diseases. And that's the bottom line tonight. Many thanks for watching. My name is Yusuf Ibrahim. Remember, this program is aired every Monday to Thursday from 10 to 11 p.m. Until tomorrow, same place, same time. Bye-bye, and enjoy the rest of your night. Good night.